Welcome all. I'm Dr. Shagirtha, Assistant Professor, Department of Biochemistry, St.Joseph College of Arts and Science, Cuddalore. In this video, I'm going to talk about diabetes mellitus. First, what is diabetes? Diabetes is a condition that happens when your blood sugar is too high. It develops when your pancreas doesn't make enough insulin or any at all. When your body isn't responding to the effect of insulin properly. Diabetes affect people of all ages. Most forms of diabetics are chronic and all forms of manageable with medication or lifestyle changes. Glucose mainly comes from carbohydrate in your food and drinks. It's your body go-to sources of energy. Your blood carries glucose to all your body cells to use for energy. When glucose is in your bloodstream, it needs help a key to reach its final destination. This key is insulin. If your pancreas isn't making enough insulin or your body isn't using it properly, glucose builds up in your bloodstream causing high blood sugar. The term is known as hyperglycemia. Over time, having constantly high blood glucose can cause health problems such as heart disease, nerve damage, and eye issues. Now, we discussed about the types of diabetes. First one is type 2 diabetes. With this type, your body doesn't make enough insulin or your body cells doesn't respond normally to the insulin. This term also known as insulin resistance. This is the most common type of diabetes. It mainly affects adults but children have it as well. Pre-diabetes. This type is stage before the type 2 diabetes. Your blood glucose level are higher than normal but not high enough to be officially diagnosed with type 2 diabetes. Next one is type 1 diabetes. This type is an autoimmune disease in which your immune system attack and destroy insulin producing cells in your pancreas for unknown reasons. Up to 10% of people who have diabetes have type 1 diabetes. Next one, gestational diabetes. This type develops in some people during the pregnancy. Gestational diabetes usually goes away after pregnancy. Next one is a latent autoimmune diabetes in adult. Like type 1 diabetes, latent autoimmune diabetes in adult also results from an autoimmune reaction, but it develops much more slowly than type 1 diabetes. Next one is maturity onset diabetes of the young. So, in this maturity onset diabetes of young, also called monogenic diabetes, it happened due to an inherited genetic mutation that affect how your body makes and uses insulin. There are currently over 10 different types. It affects up to 5% of people with diabetes and commonly runs in families. Last one is neonatal diabetes. This is a rare form of diabetes that occurs within the first 6 months of life. It is also a form of monogenic diabetes. About 50% of babies with neonatal diabetes have the lifelong form called permanent neonatal diabetes mellitus. For the other half, the condition disappears within a few months from onset, but it can come back later in life. This is called transient neonatal diabetes mellitus. The symptoms of diabetes mellitus. It is the most common one. Approximately 37.3 million people in the United States have diabetes, which is about 11% of population. In type 2 diabetes is most common form representing 90% to 95% of all diabetic cases. About 537 million adults across the world have diabetes. Experts predict this number will rise to 643 million by 2030 and 783 millions by 2045. So, main symptoms are increased thirst, dry mouth, frequent urination, fatigue, blurred vision, unexplained weight loss, numbness, and then frequent skin and vaginal infections, slow healing. These are the main symptoms of diabetes mellitus. So next one is the causes of diabetes mellitus. So mainly the causes first insulin resistance. Type 2 diabetes mainly result from insulin resistance. Insulin resistance happen when cells in your muscles, fat and liver don't respond as they should to insulin. Several factors and conditions contribute to various degree of insulin resistance including obesity, lack of physical activity, diet, hormonal imbalance, genetic and certain medication. Next one is autoimmune diseases. Type 1 diabetes happen when your immune system attacks the insulin producing cells in your pancreas. Next one is hormonal imbalance. During pregnancy, the placenta releases hormones that cause insulin resistance. You may develop gestational diabetes if your pancreas can produce enough insulin to overcome the insulin resistance. Other hormones related conditions like Cushing syndrome can also cause type 2 diabetes. Pancreatic damage. Physical damage to your pancreas from a condition, surgery or injury can impact its ability to make insulin, resulting in type 3 diabetes. Last one is a genetic mutation. Certain genetic mutation can cause the neonatal diabetes. So main causes are insulin resistance, autoimmune disease, hormonal imbalance, pancreatic damage and genetic mutations. So next one, the complications of diabetes mellitus. So these are acute diabetic complications like hyperosmolar hyperglycemic state, diabetes related ketoacidosis and severe low blood sugar level, that otherwise known as hypoglycemia. So next one is a long-term complications, mainly coronary artery diseases, heart attack, stroke, atherosclerosis. So other complications included nerve damage, neuropathy, which result in numbness and pain, nephropathy, which can lead to kidney failure, and retinopathy, which can lead to blindness, diabetic related food conditions, skin infections, amputations and hearing loss. These are the long-term complications. Next one, the diagnosis of diabetes including fasting blood glucose test, random blood glucose test, HbA1c test and oral glucose tolerance test. Thank you.